Shot. All right, I have this skinny little noodle dilator. I'm trying to find this little corner to the right side to enter, and then I'm going to go to the center. So starting out lateral, and then moving medial once I get in there. I basically have to get by the nerves. Shot. 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 Because you know, my mom always said spine surgery would be a lot easier without blood vessels and nerves. I have the tiny little needle in the disc. Shot. I'm going to inject this contrast media right here. It's got blue dye. I'm going to watch it leak out the back. Shot and save. Shot and save. Ooh, there it goes. Oh, you can totally see it going straight out. Notice how nothing's going out the front, because there's no tears out the front. What? It's correlating with the MRI, and that is really reassuring and comforting. It's like a little warm blanket. So I'm making this opening bigger and bigger. Shot. And this is the part that scares most surgeons, because as surgeons we like to see everything with our naked eye, but you know what? McCoy from Star Trek, he's a surgeon, but he doesn't look at everything. He uses a little tricorder, because all surgeons of the future are really going to be interventional radiologists. So I'm practically an interventional radiologist. Look at me. Shot. Got it. All right, I have the camera scope in. I'm looking toward me laterally. So that's the thing about endoscopy. Depending on how you rotate the camera, you're like upside down and backwards. So you have to almost disassociate your brain from the earth. And you have to basically jump into a virtual world. And now all of a sudden, I don't know what's left or right. I just know that when I make a movement, it goes in one direction on the scope. I don't even pay attention to what's happening in my hand up here, except to double check things. All right, now I'm looking medially, or toward the middle, where the kakapupu is, and you can just see it all right there. And I already felt it, but the back of the disc should be really, really firm, like a hockey puck. But look at that little empty area right there. I can feel a soft spot, I guess. And that's probably where the trapped piece of annulus is going to be. And that's why it's all blue over here. Some of the blue is because I entered right here, but more medially, it should not be blue. It can only be blue if there's a tear and the dye leak from the middle of the disc and out the tear. So look how cool this is. So where I went in, it's blue because there's an opening from where I went in, a tiny one. And then there's this whole big white area, and then look more medially. There's a separate blue area right there. See that? Underneath the dural tube. Look how blue it is right here. This is at the middle of the spine. If you look up on the x-ray over there, you can see I'm all the way past the midline to the other side. So that's how I fix both sides from a one-sided approach. Just the angle. It's just geometry, but point being, look how blue it is way out here. That is the kakapupu, and that's what's got to go away. And it's incompetent right there. It's not horribly soft, but there's an empty area right there. You're going to see a bunch of stuff coming out, and there's a bunch of blood vessels there because it's inflamed. Using my favorite instrument, the laser, because it's magical. It's somehow, without electricity, because if I use electrical currents in here, it could potentially conduct and shock the nerve. That happens intermittently. This is more mechanical, and your nerves are really sensitive.
Small jugs.
All your negativity is just making me stronger. Okay, here comes the fragments. Oh, baby. Nucleus fragment so that it doesn't keep pressurizing and leaking out. And any obviously loose pieces that will re-herniate out. And then treat the tear so that it reinitiates the healing response. And hopefully this time it will go down the correct pathway and the inflammation step will turn off after it's done. But every once in a while, when the inflammatory process does not turn off and just stays on, then you get chronic pain. This is what happens in the back. That's my hypothesis. That's what happens when you get tennis elbow, golfer's elbow, plantar fasciitis, shin splints, greater trochanteric bursitis/tendinitis, PSIS tendinitis, and a host of other chronic conditions because the inflammatory system is powerful. Without it, we would die of an overwhelming infection and we would never heal any of our wounds. But it's a complicated process and every once in a while it goes wrong. And when it goes wrong, that's when you get these kind of chronic pain syndromes. And I'm basically reinitiating that healing response because odds are it will go down the right response this time because most of the time, the vast majority of the time, it does so. Shockingly. If you're really unlucky, it goes down the wrong pathway twice in a row. And that happens about 5% of the time, maybe 10, and patients don't get much better. Still better than 0%, which is basically what most people have been dealing with up till the surgery, trying to treat this non-operatively, and being told that when it gets bad enough to have a fusion, but a fusion surgery is, I don't know, drastic. It's like chopping off your arm because you don't like it for some reason. Oh, that makes me feel so good right here. Because until I got all the way over here, I was thinking, there's a few, but not a lot. There's a fine balance between taking out loose disc material and not overdoing it because the remainder of the disc still has to have a shock absorbing function. So generally don't want to go too crazy. My favorite tooth, Terry, now. I know I'm all the way across now. Look. All right, I got everything. All the way past to the other side. Here's the dural tube. Look away because I don't know about you, but I get the goosebumps when I see the dural tube. That's where all the nerves are. Look at that. It'll start pulsating in a second. Check that out. There's not even any water flowing, so it's just basic. I got everything that I need to get to. The bleeding is under good control. Just ignore that big blush of red. Look away. Oh, yes. Oh, look at that dural tube. To me, that is so provocative. I get goosebumps. Alrighty, now I'm going to go out of the canal. There's the ligamentum flavum. It really is yellow. Flavum is yellow in Latin, I guess. And then the facet joint is right out here. The surgery went absolutely perfectly. I am so excited. And I'm looking forward to you getting a lot better so we can talk about all the cool things that life has to offer, including the best Netflix shows, the best fighters. If you play golf, we're going to set up a golf tournament one of these days. So best wishes on a speedy recovery, because this surgery went perfectly. And I'm really, really happy and optimistic about your results. All righty. My favorite part of the case, being done. No, I'm kidding. Well, not totally kidding. But check that out. That is like a Band-Aid from the grocery store. But I'm sure it's a lot more expensive. Oh, best wishes.